Hi, my name is Martin Doyle and I'm just introducing the digital biothermal red moist heat pad, and I'd like to introduce you to Susanna Crozier. And Susanna has been a patient of ours for how long, Susanna?
About 5 years
About
now.
5 years. And Susanna is unusual in such that we've been one of my few patients who's been in chronic pain. And if you just want to just share that a little bit with us, Susan, about how it all started and how you're coping and how you manage this chronic pain.
Okay. I'm 62 years old and I've had chronic pain in my lower back from degenerative discs for well over 20 years now. To manage it, I go to the physio. I walk, I exercise, sometimes I swim, and I use the biothermal heat pad on my lower back, and all of that combination seems to relieve the pain. I do Mackenzie's stretches as well for the lower back, which helps. And just over a year ago, I sustained a hamstring injury. I pulled the hamstring entirely off the bone, and Martin has been doing the rehabilitation as far as the physio. That has been a long course of rehabilitation. It's coming up to a year now, and I do the similar things, walking, a lot of stretching, the heat pad, and because of the nature of the hamstring injury, it has caused bursitis in both of my hips. So I find the heat pad, the biothermal heat pad, very useful in putting around my hips to manage the pain there.
And do you use the biothermal red at home?
Yes, I
So
can.
you sit up with it wrapped around?
Yeah, I sit up or I lie down on the bed,
Yeah.
and just wrap it around my hips.
So you have it round the front? Or
No, I kind of
on the side?
on the side,
Yeah.
just around this area. I'll do that hip, and
Yeah.
then I'll do the other hip,
Okay.
and I do across the scar
Okay. And
as
so
well.
what I'd like you to do, Susan, is to roll over, and I'll just demonstrate how I use the moist heat pad from a physiotherapy perspective.
Okay.
I'll just roll over there, just lie down there. Just put that head there, Susan. Okay, and rest there. Now, I'll just get my pillow. Now remember, Susan, as she said, she's been in chronic pain. How many years have you been in chronic pain, Susan?
Oh, probably coming up to 30.
30 years in chronic pain. And the x-rays and MRIs of a lumbar spine do demonstrate disc narrowing, disc compression at L4-5, L5-S1. So that correlates with the pain she's getting in this distribution here. Remember, the bursitis bilaterally that she was getting was on both sides of the hips. So there can be contributing factors to the lumbar spine as well as classical bursitis on this sort of area. And so how I use the biothermal red, so I may start off, depending on how acute, thank you Susan, depending on how acute or chronic the condition is. If the patient comes in with quite acute pain, I will start with the biothermal red straight away to help with pain management. And as in Sue's case, we probably wouldn't have these shorts on, she could just have her underwear on. I'd put this straight across here. That way I'm covering the lumbar spine and I'm covering the bursitis. Remember, if she had inflamed burses, which a lot of the times I couldn't feel any tenderness on here, so I was thinking there may be a contributing factor from the lumbar spine. So the heat, infrared moist heat's good to go. With bursitis, if it was really severe, the management is sometimes to get an ultrasound, and if it's swollen, we can then cortisone the injection. But remember, with Susan's chronic condition, that degeneration, the fact she had a sitting job, which long hours of sitting, that would have been a strong contributing factor to Sue's problem. So this is how, as a clinician, I would use the product for Sue, for her lumbar back and her bursitis, minus the trousers. Now, The other thing, as Susan mentioned, over a year ago, she had an avulsion injury to the hamstring. So Susan's very kindly allowed us to show you the scar. I don't know if you can see that scar here, but you can see a surgeon, a well-known surgeon in Sydney, has managed to reattach that hamstring that had completely ruptured off the ischial tuberosity. The MRI showed it was 95% off the bone, and so we're quite fortunate that we do have surgeons that can reattach that. But as Susan said, it's been a long process in the rehabilitation of this condition. And as most clinicians would know, tendons are one of the most challenging conditions we treat as physiotherapists, mainly because they've got poor blood supply, and also the research over the years has been a little bit conflicting as to what is beneficial for them. But luckily we got some very good researchers in Australia, Jill Cook and people like ourselves from La Trobe University have done some great research on exercises for particular tendon conditions. And so when we're working with the tendon, we want to get some blood flow there. So as physiotherapists, at a particular stage, we may ultrasound that or lightly friction it in conjunction with concentric and eccentric exercises at specific times. But where the biothermored comes in, remember this is deep infrared moist heat. So if I'm trying to get heat to a tendon, and if you work with sports teams and you're getting people with chronic hamstring tears or calf tears, this is a wonderful form of increasing blood flow to that area before you commence your soft tissue work. And with Sue, I'd use a smaller product and just get on that ischial tuberosity, and I'd leave that on there for about 10 or 15 minutes, and then I would start the soft tissue work. So that's how I would use the biothermorated with Susan. I'd use it on the lower back, use it on the hips, and also use it on the ischial tuberosity hamstring repair. And remember, as Susan said, she would combine that with exercises, swimming and particular strengthening work. And with the hamstring, there is a particular protocol that the surgeons suggest that we adhere to during that rehabilitation process. Thank you.